We are here today for a very particular purpose. There is a panel which is going to discuss feminine sexuality as it has been postulated, discussed and interpreted by Jacques Lacan, who is an important psychoanalyst, almost succeeding Freud, interpreting, overturning Freudian positions and expanding his views on feminine sexuality. We have a panel of two very important scholars. We have Dr. Franck Rollier, who has come from France, who has joined us and who is going to talk about Jacques Lacan and feminine sexuality from a clinical perspective. He himself is a practicing psychoanalyst who teaches in the University of Paris, also a member of very important body of psychoanalysis, World Psychoanalyst Association, and also a practicing Lacanian psychoanalyst. We have with us also Professor Anu Aneja, who is Professor of Women's and Gender Studies in the School of Gender and Development Studies, IGNOU. I am Professor Savita Singh, colleague of Anu Aneja, teaching in the same university and same school. And we are all here discussing feminine sexuality. For a lot of people it is a dark continent, but there is some light that has been shed by this psychoanalyst, Jacques Lacan. I would like Professor Anu Aneja to discuss a little bit about her program, MA program in Women's and Gender Studies, in which there is a significant discussion on Lacan and feminism, feminist psychoanalysis, or feminism and psychoanalysis. Anu, could you please explain to our viewers as to what you think we are going to achieve today and what is there in your course material which needs to be also highlighted?
Thank you very much, Professor Savita Singh. As you mentioned in your introduction, this is a continuation of our episodes on Lacan and feminine sexuality, and Dr. Franck Rollier has already spoken about this subject for the benefit of our learners. Again, I would like to make some linkages between this topic and our course material. This is part of the MA in Women's and Gender Studies program, in which we have several courses both in the first year and at the second year, where the issue of feminism and psychoanalysis has been introduced to our learners. For instance, in MWG 001, which is the introductory course, Theories of Women's and Gender Studies, our learners have read about Freudian psychoanalysis, Freud as the father of modern psychoanalysis. We have introduced them to the idea of the Oedipus complex as developed by Freud, his differentiation between infantile sexuality in boys and in girls, the idea of castration, which Dr. Franck Rollier has previously mentioned, and also this whole idea, I think, which you focused on, of lack or absence, that is in Freud how woman appears as a body which lacks something or as an absence. They have also been introduced in the same course MWG 001 to Lacan and his departure from Freud. This then is developed further in another course, which is MWG 004, Gendered Bodies and Sexualities. In Gendered Bodies and Sexualities, we learn more in detail about Lacan, Lacan's perspective on Freud, how he departs from Freud in terms of especially the Freudian idea of plenitude, which Lacan then translates into the notion of the imaginary, which I think you also mentioned. So our learners are a little bit familiar with some of these subjects. Also in the same course MWG 004, Gendered Bodies and Sexualities, we have talked about feminist scholars, some of whom have taken a sympathetic view of Lacan and others who are critical of Lacan. So we have been able to introduce students in a very basic way, of course, to two different types of feminist perspectives on Lacan in the gendered bodies and sexualities course. And finally, we have another course which is of course 001 and 004 are in the first year. Then in the second year, students who opt for the gender literature culture specialization, they register for a course on postmodernism and gender, which is MWG 007. In the postmodernism course, again, they delve a little bit more deeply into post-structuralism. So, when we are talking about semiotics, and you mentioned Saussure and the influence that Saussure had, Ferdinand de Saussure had an influence on Lacan, and then how of course Lacan talks about the unconscious which is structured like language because of the Saussurean influence. So, in 007, that is the postmodernism course, we discuss the idea of semiotics, structuralism and post-structuralism, and here we again take a look at Lacan, but this time from the perspective of language, especially in the postmodern context. So, this is basically what our learners are already somewhat familiar with. So, I wanted and it was very interesting to hear Dr. Rollier speak in the previous session. I wanted to build some linkages between our course material which the students have read and some of the ideas that you expressed, and some of them of course were new ideas to them. So, we can talk about both. I thought maybe we could talk about or start with this focus on language, because we have talked repeatedly about Saussure in our coursework and the influence that linguistics has had on psychoanalysis, and how Lacan takes this shift or makes this shift from the Freudian idea of anatomy is destiny, the body, etc., and moves towards the symbolic. So, could you talk a little bit more about that, Dr. Rollier?
Thank you, Professor Anija, for your remarks and for your question. So yes, Lacan has been very much interested by linguistic, although he was not a linguist, neither a philosopher, but basically a psychiatrist, then a psychoanalyst dealing with patients. So regarding language, what could I say? Of course, Lacan put forward the fact that the unconscious, as you mentioned, is built as language, and he proposed the concept of signifiers instead of words. We use words, but he said what is important is a signifier. What is a signifier? A signifier is something which represents a subject for another signifier, which means, what does that mean? That means that when we were born, or even before we were born, we were dived in a pond, in a bath of language, and the child will have to deal with these signifiers which has been put upon her or upon him even before he was born. And these signifiers might be nice words, but also another type of words, of sentences the child may hear afterwards. For example, one patient, one woman said that when she was a child she heard her father talking to her elder brother, and her father recalled that before her birth he said, well, if it's a girl, we're going to throw her out the window. So that's kind of a sentence made a traumatism for that girl. Not when she was a girl. When she was a girl, she didn't understand anything. But further on, when she became a woman, or it made a kind of a traumatism, and that has been expressed in her body. She felt like dizziness, like vertigo in her body. That was her symptom. That's why she went to an analyst. And then, in the same time, she recreated situation in which she were always fired from jobs, for example, from all situations. That means that there is an impact of signifier on the body. And this impact creates for anybody actually, but in a more or less severe way, a kind of traumatism. Language is traumatic, and sexuality is also traumatic always, because there are no words at a certain point to express what sexuality is and what a person may experience in his or her sexual life.
Connected to what you were saying about the role of language and the entry into the symbolic structure of the child, I know you also talked about difference or la différence between men and women in terms of jouissance or pleasure, etc. And then there is this idea that women have access to an other jouissance, that is, which is not part of the phallic function.
That's right.
There is a jouissance or a pleasure which escapes the symbolic. And people like Julia Kristeva, for instance, have talked about the semiotic, which our learners have also read about. They have read about écriture féminine as expounded by Hélène Cixous, and they have read about the theories of Julia Kristeva. So I wanted to discuss this a little bit in more detail, that if this idea of the semiotic or the pre-symbolic and women's connection to pleasure, to jouissance at that level. But I also noticed that in your presentation earlier, you mentioned something about women needing language or needing words.
Right.
So is that a contradiction, that this women's desire for words in order to experience desire, and women's desire as desire beyond words, that is a desire which cannot be expressed? Or how do we reconcile these two ideas?
Very good question, thank you. So I'm not at all a specialist of feminine studies, as you know, and it's going to be difficult to discuss that. But for example, I read many books written by Judith Butler and went through her theories of performing gender. One has to invent his gender all the time. And also other feminists who criticize Lacan because they think he represents the patriarchal order always. I don't know what to say exactly to discuss about that. Regarding the second point of language, more precisely, yes. So other jouissance is beyond words. That's one thing. But to authorize herself to experience this other jouissance, that's at least what Lacan proposed. You have to say if you agree or not. I don't know on my side, because men don't know about it at all. So
yeah,
I'm not an expert
but I
of
think,
that.
I think that Lacan took this whole understanding of feminine sexuality to a level of transition from where feminists took a cue. For example, to the extent that relationship of feminine sexuality with language, linguistic structure, has been discussed much more seriously by Julia Kristeva maybe than Lacan himself cared to. That is the point, that feminists have seen some light. Semiotic that Anu was talking about and Julia Kristeva has talked about. It is a field where things are not clearly articulated, precisely for the reason that it is not part of the symbolic order. It is a realm which is beyond phallic consciousness. So that is very hard to theorize. I mean, as you said, that maybe it is not even available for men to theorize. They simply cannot have an access to it. Their access is very much built and facilitated by the phallic signifier. I think it is precisely because of that. There is a privilege that he creates for women, though he does not seriously take it. But I think that women are in that privileged position to articulate, locate, theorize and take words seriously for themselves.
I would say we, as psychoanalysts, we do hear a lot of women talking, and what we say comes from that knowledge, so from what what they say, not from what we imagine
Yes.
they could say or experience. And what I wanted to just add to what I said previously is that not all women, apparently, not all women have access to this other resource. Those who have access to it, those who feel enough confident in their partner, whether the partner is a man or a woman actually, their partner bringing some words of love, let's say, some recognition of her difference precisely, and of her different way of experiencing jouissance, which is not only on the phallic side. That's how words intervenes in this process, as far as we hear from women.
What about the role of art? Because I think Julia Kristeva talks about aesthetic creativity as an avenue of a similar kind of jouissance, which is available not only then to women but to artists, because in the process of creating, she proposes that one reaches a level of madness which is akin to, la folie, which is akin to this other jouissance which is beyond the phallic, which is beyond the symbolic in that sense. Although in art too you have a symbolic structure at the level of, for instance, the painting or the sculpture, but you also have another level which is in the process of creation. So is this a way out of this problem of essentialism that men are as such and women are as such? For instance, like Hélène Cixous says that there is a possibility of accessing the feminine for both women and men, that if we both have the masculine and feminine within us, then we all can access the feminine and we can all have access to this other jouissance. But perhaps women have an easier time accessing it because of, because culture encourages femininity in women and culture discourages femininity in men.
I fully agree with all your statements actually, but I will take them maybe one by one. Yes, definitely art is a sublimation which is available for both women and men, and through which some artists, not all, but may achieve this precisely dimension of other jouissance. Obvious with some of them, not with all. There is no immediate logic, but it is possible. Now, regarding the fact that men as well as women may have an access to other jouissance, I do agree with that. But it's very much more difficult for men, because men, they are basically oriented by the phallic jouissance. And Miller, for example, states that they have the landlord's anxiety. On the opposite, women, they have maybe, they are more acquainted to the question of loss. There is a cultural aspect, but there is also what they do experience with their body. They know something about loss. Men don't, or many men do not. Although men, they have, if they want to succeed in their sexual life, they have to get access to castration and know that there are limits to their possibility of having or to the access to an object of jouissance. If they are not aware of these limits, unconsciously, I mean, not just like that in a discussion, but if they are not built with that, they will be very often impotent, for example.
I think that some feminists like Turtle Moy, that I was talking about earlier, she thinks that it is absurd to think that powerful women are castrated. The very possibility of women to experience themselves in a manner that they overcome this lack, it is possible for them to do it. And this possibility arises precisely because this domain has been identified where they could reconcile with their dual sexualities. I clearly remember reading Hélène Cixous, in which she says that it is possible for women to reunite with their masculine self, which is within them, inside them. It is harder to reconcile with masculinity which has been constructed outside herself, which is very intimate part of the phallic structure. I think that this deep rootedness of business of castration is, I think, very it's a kind of construction, masculine construction, more than anything else. I think women are experiencing their sexuality in a much more substantive manner and challenging this whole castration business.
We don't have the same idea of castration. Castration, basically, from a psychoanalytic point of view, is a matter of language. When you start speaking, you are castrated because you never express exactly what you would like to express. That's an experience anyone may have. Basically, that's the first thing. Then, regarding each gender, everyone lives it differently, experiences differently. But in our view, women do experience castration as well, but it is not a limiting issue. It's something which gives consistence to someone, even to a woman, which authorizes her to be a woman and to identify her as a woman. Those people who do not have access to any form of castration are those we call psychotic people. It is not
and
a philosophical point of view.
What would this state represent, the psychotic state?
Psychotic people, to make it short, it could be people who have delusions, hallucinations. That's the most severe part. But basically, there are many more psychotic people. Psychotic people are people who have convictions. They are very sure of everything. They have no questions. And they do face the fundamental events of their life with the greatest anxiety. Everything which is related to their origin, everything which is related to fatherhood or motherhood or death is experienced with the greatest anxiety and sometimes leads to trigger a psychosis. Many psychotic trigger their psychosis when they are to become a mother, a father, or when they have to face this question only sometimes. So that's beyond the question of gender. That's, and those don't have precisely this tool which would limit them, which would castrate them. They are beyond this innate dimension of words, and they may be invaded by jouissance, whether man or woman, invaded by thoughts day and night, by hallucinations, by the feeling of being persecuted, by the idea they are just a waste object, something like that. So that goes beyond gender. That's in our views, of course.
What about hysteria in that context?
Very good question.
Because hysteria has been very often identified more closely with women, although also with men, and you know, it is that kind of madness of language very often, or sometimes I believe represents itself as a sort of dissociation with language. But certain feminist scholars have talked about a jouissance in hysteria, and that kind of jouissance as a resistance to the phallic order.
Yes, we do agree.
What would I would like to ask your opinion on this idea, whether hysteria is an illness, whether it is a jouissance which is actually resisting the phallic order, or somewhere in between.
Usually hysteria is a quite common neurosis, most of the time related to women, as obsessional compulsive disorders are most of the time related to men, but there are of course some links, and there are some men hysterics as well. But the point is that we think that hysteria is very important in the culture itself, because hysterics are people who are never satisfied and who keep on asking questions, whoever they are, teachers, politicians, etc. They keep on asking questions, and they won't give up like that until they have some more knowledge. They want always more and more knowledge. But to put it on a, let's say, sexual level, hysterics, women hysterics, what do happen with them? They identify very often themselves as a man on the male side or on her father's side. And they do act as men, which doesn't mean they dress like men. But they might speak maybe like men, or they might behave like men. And they are interested in women, but not to live sexuality as a woman, but they're interested in what happens for a woman. They would like to know this mystery. And they very often are blocked in that position, which is a phallic one in our view. And they have to go beyond that and to go through that. And that's why psychoanalysis actually has been invented, because Freud's first patients were all women.
Like Dora.
Like Dora, first one, yes. And nowadays we have, of course, patients, hysterics still, but not only. Women are not all hysterics. Hysteria are different levels also. But it's a very important structure for civilization. That's the point I wanted to stress.
I think we've had a wonderful discussion. I wish we could have discussed more, but this is all the time that we have. Actually, what we discussed in this session, and it went on to cover some of the important issues related to that present in the program, the coursework, the material that the School of Gender and Development Studies has prepared for MA students in Women's and Gender Studies. And I think we went beyond that in terms of trying to understand some of the deep issues seated centrally or marginally in the psychological sphere of human mind, particularly which deals with female sexuality. I am sure that this discussion has brought a certain kind of understanding about this complex issue for our learners and our counselors and also our friends. Thank you very much again, both of you.
Thank you.
And I think I particularly learned quite a bit, and it has been a wonderful session.
Thank you.
Thank you.